We now welcome a pre-recorded testimony from the Fangak project in South Sudan, where we will see what the field is doing in terms of schistosomiasis prevention and treatment. Dr. Aminu Lawal, Bazam, Adamu, Awal, and Ganpol, with the rest of the team, will present this video. I hope that you are connected with us. If not, we will see you maybe later in the conversation over coffee. Over to the testimony.
Hello, everybody. My name is Bazam Adamu Awal, Outreach Activities Manager, working with MSF OCP in Fangak, South Sudan. Today, I'm going to present on targeted administration of Praziquantel for suspected schistosomiasis patient in Fangak project. The population treated by MSF comprises of both the native and displaced population. They are experiencing both insecurity and flooding. The Al-Sud Swamp is one of the biggest fresh wetland in the world, which swell to cover an area nearly the size of the United Kingdom, up to 9,000 kilometers squares during the wet season. You can see how women and children are coming to the MSF hospital in Jonglei State. You can see how chances of coming in contact with the contaminated water that mostly carrying the S-Mansoni and extremely high endemicity and S-hematubium was determined by WHO. In this mode of transportation by canoe, definitely there is no any chance where someone can prevent himself from becoming in contact with this water. So that is to say, through this means there is a high risk of even coming in contact with water that is likely to be infected. MSF Fangak project was opened since 2014 in order to respond to an influx of more than 20,000 internally displaced population, where MSF provided healthcare services, IPD, maternity, OPD, ANC, as well as mobile clinic to some other outreach locations. From March 2021 to February, the MSF Fangak project saw 286 adult patients on average per month, response to genitourinary and gastrointestinal symptoms suggestive of potential schistosomiasis infections.
Good afternoon, everyone. I'm Dr. Aminu, the medical team leader at Fangak project. I will continue from where my colleagues stopped. From WHO recommendation, high prevalence areas should be prioritized for national one-yearly Praziquantel mass drug administration because intermittent Praziquantel cures early symptoms and prevents chronic irreversible complications. Despite Fangak being identified as very high prevalence area, this preventive chemotherapy has not yet been delivered to the population. In improving clinician index of schistosomiasis suspicion and treating suspected patients, since May 2002, in Fangak, the clinicians began empiric Praziquantel, one dose presumptive treatment of schistosomiasis to all patients aged above 2 years, which include pregnant and lactating women who present with signs and symptoms highly suggestive of gastrointestinal or genitourinary schistosomiasis. The clinical features include blood in the urine or stool, pain passing urine, frequent urination or urethra or vaginal discharge, painful intercourse, pelvic pain, enlarged liver, diarrhea, which could be either intermittent or chronic, with or without blood, with abdominal pain. For this, not replacing the MSF clinical guideline, started reinforcing the MSF and WHO guideline, which is the Praziquantel therapy added to whichever appropriate general antibiotic. For pediatric schistosomiasis, talking about school-age children 5 to 15 years of age, they're prone to have schistosomiasis due to the hygiene, swimming in the river, as earlier highlighted by my colleague, and the fishing habits here in Fangak. Lots of children go to fish, so which make them vulnerable to infection. Also including the female genital system. And I'm talking about the young women and the girls. Those children less than 5, they are also at high risk, but although they're a bit neglected because of lack of pediatric dispersible formulation. So in the interim, covered in Old Fangak, we give treatment to children above 2. Tablet can be crushed, while for children less than 2 years of age, WHO recommends only case-by-case treatments based on testing and clinical judgments until infant formula becomes available. Praziquantel induces a partially protective immune response against infection, so hence early treatment is justified to reduce infection and long-term mobility. For re-exposure occurs frequently with water exposure, but early and repeated therapy will reduce the infection and morbidity. So one of the WHO recommendations that Praziquantel for pediatric school age group, those are children 5 to 15 years of age, should be integrated in ongoing public health intervention, which can be integrated into the routine EPI activities, Mother-Child Day celebration, and the Child Health Days celebration. This is our lab in Old Fangak, which it has the basic laboratory resources that we can for our regular activities. So in this lab, we can do basic microscopy, like urine. We can do urine microscopy. We can do malaria microscopy, among other basic investigations. For diagnosis of schistosomiasis, the sample is collected from the reception. From the reception, it comes into the lab. Coming to the lab, in the lab, we centrifuge. After centrifuging, then the technician prepare a wet preparation, which is to be viewed under microscope. So this process takes an average of about 20 minutes for him to see if there's Mansoni or hematobium. In our lab here, we can do basic transfusion, basic hematological and microbiological investigations. Here in Old Fangak, we have some challenges. Like earlier said, population access were in a remote, precarious setting, and of recent, due to flood and insecurity along the Upper Nile, we have some internally displaced populations scattered around Old Fangak. So with this, we have a lot of people, some don't have access to hospital, so there can be lack of access to get the basic diagnosis and treatment. Here we're in a swamp where snake control is not feasible. Here, the only means of transportation in Fangak County as a whole is the water transport. So with this, the population are prone to repetitive water exposure, which calls for need for repeated treatments as a result of the infection. Visibility of burden, talking about the data collection and single diagnosis in DHIS. Currently, our data collection tool does not take into consideration of this. So it's something that we can work on for the future to see how we collect appropriate data to schistosomiasis. For the lab confirmation, is not always feasible. Talking about sample collection, transports, the added burden, staffing, and other logistics surrounding this. I will start talking from both the internal. Let's talk about the hospital setting. In the hospital, sometimes the OPD can be overwhelmed with a lot of patients, and the lab also have the mandate to attend to both outpatient and inpatients, and also patients from SSMR, that's the other partner in Old Fangak Hospital. So with this, getting the routine test for those who care or who come with signs and symptoms suggestive of schistosomiasis, either urinary tract symptom or the bowel symptom, may not be really feasible. For example, if you have like 10, with the constraints, we may not be able to take samples from the 10 patients the same day. And another challenge we have here is lack of pediatric formulation for children less than 2. This video illustrates when we're going for assessment in one of the IDP camps, which was a resultant effect of the previous recent clash along the Upper Nile, so which made a lot of people to be displaced. So in these here in Fangak County, the only means of transportation is through the river. Making use of, for MSF, we make use of speedboats, and while making use of speedboats, we encounter some challenges related to the flood. Due to flood, some communities and waterways were flooded, and as a result of the flood, some grasses are moved by the river, which block the waterways. This video shows the outreach team going for an IDP assessment, and here they got stuck. And for this, they have to push boats. Sometimes this take up to 30 minutes to 45 minutes.
We are here in Lele, in an area which is isolated from medical service, a home to thousands of displaced persons due to the current conflicts in New Fangak. And we came here a couple of months ago, and this area was quite dry, but now it's only flooded with a lot of water. Yes, we are going to this area. We had an assessment Now we're going to have a discussion with community leaders and see how we can select and CVDs for ICCM activities implementation in this area. You can see here the area is flooded. However, it could be results of the few heavy rains that fell in October, but now it's quite clear that the rain has stopped for the first few days. Just hoping that this area gets dry again.
In conclusion, children who are within the school age group and the preschool age group are at high risk of exposure and morbidity. Girls and young women also prone to female genital trisomiasis, which increases risks of human papillomavirus and HIV infection. For the intent of talking about the treatment, Praziquantel is a safe drug, safe, effective, and very cheap. So it's safe to combine vitamin A, albendazole, Praziquantel to facilitate opportunistic administrations whenever we have the opportunity to do this. It is safe to administer anti-malaria with Praziquantel, though have risks of causing nausea. So, but if you are giving this as clinicians, we need to tell the patients about the possible side effects. And at the community level, there's a need for community sensitization, which involves the health promotion and community education, which is very important from the public health perspective. Old Fangak Schistosomiasis program is an example of innovative integration of a neglected tropical disease program into a routine program, which is cheap and very effective. MSF response to neglected tropical disease does not have to be vertical. The outcome is very cost effective as it reduces morbidity associated with neglected tropical disease. Thank you for listening.